So thank you for having me. It's an honor to deliver the keynote address for the 5th International Conference on Health Sciences Research. Today I'm going to be discussing COVID-19, current data, risk mitigation strategies, and debunking some of these myths that are floating around. My name is Saritha Bangara. I'm co-director and assistant professor of the public health program here at Austin College. And so we hear a lot of terms in the literature and the media, but what do these terms like epidemic and pandemic, what do they actually mean in an epidemiologic context? An epidemic is an increase in the number of cases above what is typically expected in a particular area. So let's say for a specific calendar year, we expected to see 0 cases of a specific disease. Even if we get 1 case for that specific disease, that can constitute an epidemic. A pandemic is very different from an epidemic. It is an epidemic that's really out of control that crosses international boundaries. Another term that we're hearing a lot about in regards to COVID are super spreaders. So what are super spreaders? Super spreaders can be a person or an event that for unknown reasons it can lead to infecting a large number of people. So isolation and quarantine are often used interchangeably. However, these terms are different. What do we mean by isolation? When you keep people that have a confirmed COVID positive test result and separate them from people that are not sick, that is isolation. Quarantine, on the other hand, is when you keep people who are possibly waiting on test results. We're not sure if they have a confirmed test result. They may have potentially had some type of exposure to someone who was COVID positive, but we're separating them from healthy individuals. So that's really what the difference is. Isolation, confirmed diagnosis. Quarantine, we're still waiting on test results. So we're discussing COVID and we're analyzing the spread of COVID-19. In regards to the highest risk of infection, there are 3 specific C's that are related to COVID. And what are those 3 C's? Closed spaces with poor ventilation, crowded spaces, and close contact settings in which people are talking face-to-face in close proximity. All of these 3 factors increase the transmission of COVID-19. Now, other terms that you may have heard about, and it's all over in the news, reproduction number and effective reproduction number, R naught really tells us how many secondary infections can be expected from each infection. The other term, RT, which is referred to as the effective reproduction number, tells us how rapidly the virus is spreading. So when we go back to R naught, if one person develops the infection and spreads it to 2 people, then R naught is 2. Okay? You want to keep R naught under 1. That would be ideal. In regards to RT, the effective reproduction number currently in Texas, it's about 1.12, which is not great, which tells us that the epidemic is spreading, or the pandemic is spreading, and RT is another number that you want to keep below 1. Another term often talked about when we're talking about the spread of COVID-19 is the positivity rate. What do you mean by positivity rate? The numerator is the total number of confirmed cases, and the denominator is the number of people tested or the total number of tests performed. So essentially, when we're thinking about reopening states, we want to make sure, according to WHO, that our positivity rate is below 5% for at least 14 days before we can safely reopen states. Flattening the curve. We talked a lot about flattening the curve early on, especially in the pandemic when cases were spiking. What is the strategy? What is the goal behind flattening the curve? Flattening the curve helps slow the spread of the virus, decreases transmission, so therefore we do not overwhelm hospital and healthcare facilities all at once with a bunch of patients coming in with COVID. So what do we know so far about COVID? We all know that COVID is an infectious disease. It's contagious. It spreads very quickly. The agent is a virus. The host can be any human, but we know that people that are older or immunocompromised are at much higher risk. The reservoir so far, what we think it is, are bats and pangolins. The incubation period is what is the most concerning about COVID. The incubation period is up to 14 days, and the median incubation period being about 5 days. And what that means is I could be exposed today and not show symptoms for the next 14 days. That's what makes it really hard to contain this virus. So an important slide, because we're really talking about the transmission of COVID. There are 3 specific ways that COVID is transmitted. And COVID is primarily transmitted from person to person through respiratory droplets when a person coughs, sneezes, or speaks. An indirect way of transmission of COVID is by touching contaminated surfaces or objects and then putting your hands inadvertently to your nose, eye, or mouth. So any of these mucous membranes. Now, what's even more concerning is that recent research provides mounting evidence that COVID is not just transmitted through droplets, it is also transmitted through aerosols, which are much smaller droplets than those that are expelled when you cough, sneeze, or speak. So the focus of my lecture today is really on these 3 specific mitigation strategies, which are hand washing, wearing a mask, and social distancing. Now, hand washing is very important to think about, especially, well, let's say we don't have, soap and water is unavailable. You can still make sure you have to use a hand sanitizer and make sure that the hand sanitizer contains at least 60% alcohol for it to be effective. Now, wearing masks and social distancing, we're going to be talking about several articles that really are based on these mitigation strategies and how effective and why they work. So why is it important to wear a mask? We talked about the incubation period for COVID, right? The incubation period is 14 days. We've seen people that have only shown symptoms 16 days after the first day of exposure. So you're walking around, you're in a grocery store, you're standing next to a person who looks completely fine. However, they could be asymptomatic, but however, they could transmit the virus. So the asymptomatic individuals transmitting the virus, and that is why it is imperative for us to wear a mask even when we are socially distanced in a grocery store. There are too many people around. You want to make sure that you are wearing a mask outdoors at all times. So wearing a mask is imperative, and we're going to talk about a bunch of peer-reviewed studies that discuss just this. So why are masks so important? Prevention of respiratory droplets from traveling from person to person is the main way that COVID spreads. Respiratory droplets, like we talked about in the earlier slides, play an important role in the transmission of COVID. We have several clinical and lab studies that support the use of mask wearing to reduce the spread of these droplets. So what kind of mask should I use? And that's really important. There was a recent study that was published in August out of Duke University that specifically looked at different masks and how effective they are. So surgical masks, N95, which are really hard and should be reserved for healthcare providers. Cotton masks seem to be the most effective. The masks that are not as effective are neck masks, neck gaiters, bandanas, fleece masks, and masks with valves. And we'll talk about why they were not as effective. So this is really the data from that study, from the Duke study. So let's do a deep dive into the Duke study. They tested the efficacy of masks in regards to transmission of respiratory droplets during regular speech. The most effective mask, like we talked about, was the N95 with the smallest relative droplet count, followed by surgical and cotton masks. The neck fleece had a much larger transmission of respiratory droplets, 110% more than the control trial. And if you're curious as to why the droplet count was actually increased, it's because this fleece mask, what it does is it disperses larger droplets into several smaller droplets, thereby increasing the relative droplet count. So fleece masks can be worse, therefore, than not wearing a mask at all. The other 2 masks that were proven to be the least effective were bandanas and knitted masks. However, there's ongoing research to confirm these findings. So there are a bunch of studies out there right now to make sure that this is actually true. So the take-home point from that study was do not wear a mask with valves, bandanas, or gaiters. They are not as effective. These masks are not effective and the transmission rate for droplets are far greater than N95, surgical masks, and cotton masks. So what is the right way of wearing a mask? you really want to make sure that when you wear a mask, it completely covers your nose as well as the mouth. Otherwise, it really defeats the purpose. So just like this, you want to make sure the nose as well as the mouth are covered, and everything else, you're not putting it on your chin, you're not putting it on your forehead. So that's exactly the right way of wearing masks. So why practice social distancing? So COVID-19 really spreads through prolonged contact in close proximity. In fact, it only takes about 15 minutes of exposure to someone less than 6 feet away for you to contract COVID. So social distancing, therefore, limits these opportunities to come in contact with contaminated surfaces and infected people that are outside of your household. So what are these COVID super spreader events? We talked about what a super spreader is, but what do these events really have in common? So there are 3 V's that relate to super spreader events: venue, multiple people being indoors where social distancing is often hard to maintain. Ventilation is key. Staying indoors with limited fresh air increases your risk for COVID. Vocalization, lots of talking, yelling, or singing, even high-intensity exercise increases the transmission of respiratory droplets. So the odds of catching COVID-19 indoors are 18.7 times higher than in the outdoor environment. That's a pretty significant number. So let's talk about a few real-life scenarios and the science behind these findings that have been published in the last 6 months, from March 2020 to September 2020. So the first study that I wanted to highlight discusses a high SARS-CoV attack rate following exposure at a choir practice. So if you look at this, that's the index case. And if you want to know what a definition of the index case is, it's right here. In an outbreak, the first person identified by health authorities in a group of related cases of a communicable disease. So this was a 2.5-hour choir practice attended by 61 people, including a asymptomatic index case. Transmission was likely facilitated by close proximity and, like we talked about before, augmented by the act of singing, because when we sing, respiratory droplets are transmitted at a greater rate. Unfortunately, just because of this practice, and this was early on in the pandemic, so something very important to remember is that none of the people were wearing masks at this time. After the choir practice with one symptomatic person, 87% of the group developed COVID. And unfortunately, 3 patients were hospitalized and 2 died from this event. So if you look at this, you'll see the index case is the one that's highlighted in red. There were 32 confirmed and 20 probable cases, and there were very few people that were unaffected by COVID. So 87% developed COVID after this practice. The next study that I'm going to be talking about is a cluster of COVID cases associated with fitness dance classes in South Korea. So this really came from instructors passing on the infection to their students. Now, one of the instructors, for example, who attended the workshop was pre-symptomatic and developed symptoms 3 days after the workshop. But what happened is over 24 days, with all of these workshops, 112 people were infected. So why do fitness classes or exercise places, why are they not something that you want to do or visit right now during a COVID outbreak? Really, because what happens is that characteristics that lead to transmission from the instructors include large class sizes, small spaces, and intensity of the workouts. That's key. High intensity workouts make you release way more respiratory droplets than just maybe going for a walk. And especially if you're going outdoors, there's not as much concern. The moist, warm atmosphere in a sports facility coupled with turbulent airflow generated by intense physical exercise can cause more dense transmission of respiratory droplets. So vigorous exercise in confined spaces should be minimized during outbreaks. And again, important to understand that at this time that the study was published, the participants in this study were all unmasked. They were not wearing masks, and this was in March. This was very early on in the pandemic. The next study discusses COVID transmission on an international flight and among a tourist group. So this was a 4.5-hour flight. So let's step back. The flight actually was on March 9, 2020, but we'll step back and look at the timeline on March 2nd, 7 days prior to that. There were 102 passengers on this flight, and 24 people came from a tourist group. The tourist group, 7 days prior to that, had contact with a hotel manager. The hotel manager at that time tested positive for COVID about a couple of days after he had interaction with that tourist group. No member of the tourist group diagnosed with COVID before the flight. Again, the flight duration was about 4.5 hours. It was a pretty long flight. And what they found was, after interviewing 71 passengers who were interviewed, 63 reported no symptoms after the flight, and 8 people reported symptoms after the flight. So there were 2 likely SARS-CoV transmissions of the flight with 7 index cases. And those 7 index cases came from that tourist group that had prior contact to a hotel manager that tested positive for COVID. Now, in fact, looking at these numbers, we expect it to be higher. So one of the things that could potentially have reduced the transmission rate for COVID here is the airflow in the cabin from the ceiling to the floor and from the front to the rear may have been associated with this reduced transmission rate. Now, what are some of the other factors that contributed to the transmission of droplet-mediated infections, especially that we see on an aircraft? One of this is proximity to an index case. Movement of passengers and crew, fomites. Fomites play a very important role. And what are fomites, for those of you who don't know? Fomites are inanimate objects. They can be doorknobs, spoons, cutlery, any type of cutlery that transmit the virus. And then contact among passengers in the departure gate. So in this study, both passengers with likely onboard transmission were seated within 2 rows of the index case, so in very close proximity to the index case. And again, to reiterate, I want to make this very clear that none of the passengers were wearing a mask. The next study discusses COVID transmission among bus riders in Eastern China. Now, this was actually published on the 1st of September and gives us evidence about COVID being potentially airborne. So this was a COVID outbreak in China, and the total number of passengers were 128. 60 passengers rode bus 1, and 68 passengers rode bus 2. The total round trip was about 100 minutes, and they attended a 150-minute worship event. There was 1 index patient on bus 2, and again, none of the passengers wore masks. So even though this was published in September, this was all the way early on in the pandemic when people didn't even know what COVID was all about. Now, very interesting, individuals in bus 2 that had that index case had 34.3% higher risk of getting COVID compared to those people that were on bus 1. 11.4 times more likely to have COVID compared with all other individuals attending the workshop. And within bus 2, individuals in high-risk zones, and what do you mean by high-risk zones? Closer to the index case, had moderately but non-significantly higher risk for COVID-19 compared to those in low-risk zones. So this finding is different from what we found on that flight, because on the flight, we saw that being closer to the index case in close proximity increased the risk of transmission. However, in this study, it clearly showed that irrespective of whether you're close to an index case or not, if you're unmasked, you can still get COVID. And therefore, the absence of the significantly increased risk in the part of the bus closer to the index case suggested that it's not just respiratory droplets that can transmit COVID, but there is airborne transmission that can happen with COVID. One of my last studies discusses a cluster of COVID infections linked to music clubs in Osaka in Japan. So they studied about 108 cases. The test was done. They confirmed their diagnosis through RT-PCR. Of all the tests that are out there, PCRs have the highest sensitivity and specificity for COVID. 51 of the cases attended a music club once. 10 remained asymptomatic upon diagnosis of COVID-19. Now, all index cases for secondary transmissions were asymptomatic, and the remaining 41 cases experienced symptoms 2 to 17 days, even more than the typical incubation period of 14 days after initial exposure. Now, what is really important to understand from this study, the conclusion from the study is that, of course, we know that asymptomatic individuals can transmit the virus, and asymptomatic people can transmit as early as 2 days after infection. Therefore, avoiding crowded places is really important, and practicing mask wearing and hand hygiene have been effectively shown to control the spread of COVID-19. So we talked about peer-reviewed articles, we discussed a couple of definitions. Now we're going to talk a little bit about the data, the current data, which is updated on September 29, 2020. So if you look at this slide, it gives you an idea of what the positivity rate is for the United States and for Mexico. So right now in the US, again, updated on September 29, the positivity rate that we talked about, which is the number of confirmed cases divided by the number of people tested, or the total number of tests performed, was hovering at about 5 to 10% for the United States and about 10 to 20% for Mexico. And this goes back, the more you test, the better it is for the positivity rate, because only that way we're able to uncover people that are truly positive, even if they're asymptomatic. In the US, again, updated on September 28th, we have more than 7 million cases. And that number has gone up. We're now on today's October 5th. We have unfortunately lost more than 204,000 people. And 310,000 people were diagnosed with COVID in the last 7 days, from 7 days prior to September 28th. So for those people who are still thinking that this is a hoax, this is not a hoax. This is very real. This is true data, and it's so unfortunate that we have lost over 204,000 people, and 7 million cases are already, and we have more than that right now in the United States, which is a ridiculously high number. Now, I wanted to show this slide to really talk about, because at Austin College, we have an age group of our students of about 18 to 22. And we look at the data as in Texas as of 9/28, and if you look at that age group, 30 to 39 right now, we're seeing the highest number of cases, and about 20 to 29 and 40 to 49 having a really high number of cases. So it's not the older people that are getting diagnosed with COVID, it's the young people, right? So very important to realize that even people who are in the 18 to 22 age group can get COVID and can potentially get very sick from it, depending on underlying conditions and things like that. Another study that I wanted to highlight that is important, which talks about the medical vulnerability among smokers and smoking cigarettes as well as vaping, right? So most notable among the results was that medical vulnerability stood at 16.1% for the total population that included smokers as well as non-smokers. But it was 16.1% for the 6,741 non-smokers. But it was 31.5% for the full sample of 8,405 young adults, which included smokers. So from this, we know that smoking is a key factor that confers medical vulnerability among young adults. And so that's just another reason to stop smoking. And this includes, like I said before, not just cigarettes, but vaping as well. It increases your risk for being hospitalized with COVID. So the last section of my PowerPoint discusses myths and facts about COVID, right? So we've had several myths that have been floating around. And I talked about this when I did a freshman seminar last month. So the prolonged use of medical masks when properly worn causes carbon dioxide intoxication and oxygen deficiency. This is not true. Nothing happens when you wear a mask. You're able to breathe. It does not lead to carbon dioxide intoxication or oxygen deficiency. One thing to think about is that oxygen molecules are about 0.12 nanometers, and carbon dioxide, 0.23 nms, are small enough to pass through the mask compared to COVID-19 virus, which is about 120 nms. So absolutely okay to wear a mask. It does not lead to carbon dioxide intoxication or oxygen deficiency. COVID spread in hot and humid climates. So before the summer started at the end of the spring, scientists all over hypothesizing that when the summer began, COVID numbers were going to drop. We know that's not true now, right, at the end of the summer. So it can absolutely spread in hot and humid climates. It can spread in every climate, regardless of the temperature. In fact, like we saw, even in Texas, cases surged throughout the summer. So the best way to protect yourself is by maintaining physical distance of at least 6 feet, wearing a face mask, and again, frequently cleaning your hands. Another myth that's floating around there is that young adults cannot be infected by the COVID virus. I just showed you the graph, and it tells us that young adults can absolutely be infected, and people of all ages can be infected by the COVID virus. And young adults are still vulnerable to becoming sick and hospitalized, and especially if they have any type of underlying condition like asthma, diabetes. There are several conditions that put them at higher risk. Older people and people with pre-existing medical conditions appear to be more vulnerable to becoming severely ill with the virus. Antibody testing shows if someone is immune to COVID. This is a myth. All antibody testing tells us is that, so antibody testing does not show someone's immune to COVID. Individuals that have COVID or antibody positive are susceptible to getting it again. So what CDC said is if you have a test, if you test positive, let's say on the 1st of October, you can test positive again 3 months later. So you don't necessarily need to get another test if you've tested positive for COVID for at least 90 days unless you're symptomatic. But you can get, as of now, we have seen 2 individuals that have tested positive twice within a 90-day period. So ordering or buying products shipped from overseas will make a person sick. This is a myth, right? So you can get packages. The likelihood of becoming infected with COVID-19 from a commercial package is extremely low since it's likely traveled over several days and have been exposed to several different temperatures and conditions during transit. So even at Austin College here, we have a mask mandate, and especially when you're exercising indoors at a gym, in a gym or any type of indoor closed facility, it is imperative that you wear a mask. Exactly what we talked about before with the super spreader events, because when you're exercising indoors, the chance of transmission is much higher because you're expelling a large number of respiratory droplets. So even while practicing social distancing, even if treadmills are spaced 6 feet apart, it is important to wear a mask, especially while exercising indoors. A vaccine to cure COVID-19 is not available. That is true. We're all waiting for this magical vaccine that's hopefully going to come out in the next couple of months. But currently, we do not have a vaccine that we can use for COVID. There are several vaccines in the phase 3 clinical trial, but we do not have the final results from those yet. Thank you all for listening. And if you have any questions, feel free to